Lagos, it's that time for us to talk about our health here on Smooth Health on Smooth 98.1. It is 18 minutes, going to 5. Glad to be here with you and talking about your health. Let me ask you first off. You know how it is that there's an emergency, you're in an emergency situation. Do you even know what the procedure should be? I'm not saying you be the doctor or you being in that space. I'm saying as a patient, you get to the hospital and it's an emergency situation. What's the procedure supposed to be? Do you even know what you're supposed to ask for without you sitting down there waiting for hours? Because certain people can tell you, we're waiting for the doctor. Doctors are not on seat, but it's an emergency situation. Do you know what's supposed to happen? Well, I have the pleasure of bringing to you someone who's going to share that insight, give you step by step things to do, what you're supposed to know, and where the hospital also comes in. So we'll be talking about the right emergency procedure that the hospitals should follow, that you as well as a patient need to know. Because if you don't know it, how would you be able to call it out? Hence why I have with me the one and only Dr. Tobechi Ozuzu. Good evening. Glad to have you with me.
Good evening. Same as always. It's so good to see you.
Yes, although we're virtual, this I'm jealous, but I shan't get into that space just now. I shall leave that behind the scenes. But I'm glad to have you here as
Thank you
always.
so much.
And
Thank you so
one
much.
thing I love when we're having conversations like this is how you get to break down the nitty-gritty is you call it out as it is, not
Yeah.
you're not making anything up or trying to butter the side that's that supposedly butters your bread.
Both sides butter my
even
bread, actually.
even as a doctor, you're calling out the things.
It's for for everyone to be better. For everyone to
Well,
be better.
I agree. I agree. Hence why when we ask for your attention, you always oblige, and I'm glad to have you here.
You're
Without
welcome.
much ado, we're going to get straight into this conversation. And this is as a backdrop of what has happened most recently. So we're not going to focus on the snake bite. No, that's not just the only reason why we're having this conversation, because certain people don't
Okay.
even know what the procedure should be.
Okay.
Um, some people don't even know that ambulances can be requested for because
Yeah.
you're not supposed to be driving yourself when you're unwell. But you will find a person will go, even in their sick state, they're driving, but they're afraid that, can I even call for services? And I'm talking about the ambulance service. Do I even
Yeah.
know that I can do this? So let's even get to start off with an emergency situation. When an emergency patient arrives at a hospital, what should be the very first thing that happens before they start to ask for the paperwork, before paying? Hey, see this one? We're not moving away. See that thing? There's, oh, do you have a card with us? Have you
No.
made payment? Oh my days. I'm in pain. How you asking me this kind of questions? How am I supposed to joy breathe? So,
Okay. Okay. So let's talk about it now. The difference between life and death is time. All right.
right.
Time. The fact that you get treated within 3 minutes, and the fact that you get treated within 30 minutes, and the fact that you get treated within 3 hours determines whether you will live or not. What
Yeah.
makes an emergency service very, very active is that time should be on your side. Now, the good thing about it is most hospitals, remember, we always tell you that there are certain capacities that hospitals should exhibit. They
Okay.
try to monitor the turnaround time for their ambulance services. What I mean by emergency services is the time it takes from the point you get to the gates
Mm-hmm.
to the time you get to the emergency bay and the time you get in. Now, what most hospitals want to do is they try as much as possible to shorten that time. So let's say, for example,
Okay.
you have an emergency and you're coming into the hospital.
Mm-hmm.
Gate men are trained that once they see somebody in distress or an emergency, automatically they're not medical physicians, they don't know anything about it.
I
They
agree.
click the alarm bell that rings in the ear in the emergency. Yes, yes. In most hospitals,
Oh,
they have an alarm switch. So let's say, for example, you're coming in distress, someone is in emergency, automatically they click the alarm. Now, what does that? Saves you some precious seconds. The
okay.
emergency team comes out immediately. All right. Now, once they come out, as you're coming in, you see them coming out. They will do
Okay.
a quick cursory examination on the
Okay.
patient. What's going on? What's this? That. Now, within that duration of time, this is within 1 or 2 minutes. The doctor or senior nurse scans, makes an examination, and determines that, okay, this is an emergency we can handle, and
Okay.
ushers you in. So it's
Okay.
expected that from the point of contact, which is the gate, to the
Mm-hmm.
time when you get into the ER bay,
Mm-hmm.
should be nothing less than 3 minutes.
Okay.
Yes, if people practice that, nothing less than 3 to 5 minutes. From the
Mm-hmm.
moment you come into the ER bay to the moment the doctor examines you and sees that it's an emergency, is this, to the moment you go into the ER proper, it's
Okay.
3 to 5 minutes. Now, once you get into the ER proper, the
Mm-hmm.
care is timed. Okay, one person, that's why most ER units are staffed. If there's any unit that is not, that should be fully staffed, is the ER centers.
Okay.
Um, One person starts giving you IV infusion, the doctor starts examining you, one person starts collecting blood for sample, one person starts getting medication from the pharmacy. See, so once you divide the labor, at the end of the day,
Right.
everything is done
In
within,
good
so it's
time.
expected that the turnaround time in the ER,
Mm-hmm.
give or take less than within 30 minutes. Now, if that is achieved, so remember what we counted, 3 minutes
Three
to
minutes first from
from
the
5 minutes
point of
yes,
entry to right.
exactly. And then 30 minutes for you to, at least for you to be able to have care. So we're looking at
Mm.
between 30 to 35 minutes. That period is enough time to arrest
The
whatever
situation.
emergency you're going on, that is going on.
Okay.
Now,
Okay.
remember that the first stage was 3 minutes. Remember, that
Mm-hmm.
gives you the capability to assess and say, okay, oh, we cannot do this right here. You understand? You don't waste your time,
Okay.
because time is important. We don't waste your time. For example, let's say it's a bullet, maybe it's a gunshot wound to the chest. And then
Okay.
the hospital, remember there's a small hospital that doesn't have,
Mm.
that doesn't have, the big emergency services. You remember that those 3 minutes, the doctor says, oh, we've seen this, we've examined this.
Mm.
Please, we are referring you immediately to maybe Lutz or to a bigger hospital. You're
Right.
saving that life. You're not wasting time dilly-dallying. But if
Trying
it's
to
a
be a
big hospital,
superhero. Mm.
yes. If it's a big hospital, okay, you
Okay.
come in, they take care of you. Now, once they start treatment, it's expected
Mm.
that the turnaround time for a patient. So the reason why I talk about time is that, remember, you may not be the only emergency case coming in. And then
Fair
doctors
enough.
time themselves to give you the absolute care. So in most hospitals, even in abroad, even in Nigeria, you're expected
Oh,
to
yeah.
spend a minimum of 4 hours, a maximum of 4 hours in the ER. Yes. So that means from the moment you come in, that's 5 minutes, to the moment you get treatment, that's 30 minutes. Then they now give you another 2.5 hours to stabilize, to be sure that, okay, you're okay.
Everything's
Then they can
okay.
either discharge you or transfer you to the ward or transfer you to the
Okay.
ICU, depending on the severity of your case. So you see how everything is time constrained, break by
Right.
break by break. But the problem we have is that most people don't understand that you deserve this time. Most people don't understand why ER. That's why. So let me give an example. Sorry that we're debating. So remember those few
No,
minutes
no,
I
no.
told
Go ahead.
you?
Yes.
Yes, those few minutes that, remember I told you, from the moment from the gate to when the doctor assesses you with before the ERB, there's enough time for him to say, okay, see, this issue now,
We can handle
it's
it.
it's asthma. It's something you can handle in the OPD. It's not an emergency case. That's what you call triage.
Ah.
You understand?
Oh,
You, that's triage.
yes.
You now triage it immediately. Oh, I'm okay. This is probably maybe stomach
Something.
pain. So you could have
Mm.
stomach pain that could be due to a burst appendix, which is an emergency that should go into surgery immediately. You could have stomach
Right.
pain that is due to an ulcer, which you can
Mhm.
treat in the ER. Why you can have stomach pain due to maybe you did exercise and your tummy is paining you. So, so you see how we've categorized the stomach pain. One
Right.
requires immediate surgery, theater
Surgery.
immediately. We don't waste
Right.
time. One requires you to be resuscitated in the ER, while the other
Mm-hmm.
one requires you to sit down and and rest.
Right. So you
Yeah.
have to assess every situation to figure out what works best.
Yeah.
Hmm. Now that is very, very enlightening. And one of the things that I'm going to reference now is who really should take charge because you've mentioned the doctors, you've mentioned the nurses, who should actually take charge in an emergency situation. Most of the time,
Okay.
you have nurses on duty, and sometimes, permit me, I might be right, I might be wrong, but you see certain people on duty, they might not even know what they're supposed to do. And we've seen how things can go awry from that. So,
Okay.
who
So
is how to work through this?
okay. So in an ideal situation, the doctor is the head of the ER team. All right.
Okay,
You
okay.
have now it's a multi-systemic team in the sense that apart from being a doctor in the ER, you
Mm-hmm.
also have the capabilities to call other physicians who may come to assist us. So let me give you an example.
Okay.
Uh, now, once there's an emergency case,
Mm-hmm.
once they call, is the doctor and nurse come out, everybody comes out
Right, yeah.
and
Okay.
assesses. All right.
Right.
Well, the doctor's assessment is primary. He makes the assessment to say, okay, this is what we have here. This is how we
Mm-hmm.
can handle this. We cannot handle this because at the end of the day, he will be the one to document. He will be
Okay.
the one to document. So whatever else we're trying to do, whatever else anybody is trying to say, he needs to document. Now, once that happens, the
Mm-hmm.
doctor takes charge. Remember, everybody has a capability, their duties. The nurses
Mm-hmm.
may get the treatment sheet, may start CPR, may start getting fluids into the person. One nurse may be
Mm.
taking things, but it's the doctor that takes charge and
Okay.
makes the preliminary diagnosis. Now, that preliminary diagnosis is what will enable him to say, okay, okay, let me give you an example. Let's say someone comes in now with a fracture. All right.
Okay.
Let's say okay, no. There was a road traffic accident. Beautiful. Let's use that as an example because that is
Mm-hmm.
it's about two-thirds of most ER cases, RTS accidents that happen. So they bring
Mm-hmm.
someone into the hospital. Person is bleeding, is unconscious, and all. You understand? Now the doctor assesses and says, okay, look at what we have. Person is bleeding. Let's stop the bleeding. They stop. Let's rehydrate. They give. The person is in pain. Let's give pain. Now the
Mm-hmm.
person is stable. Let's now know what the other issues are. So you see, the person has a broken leg, a
Mm.
broken hand. At that point, you now call for an orthopedic surgeon who now comes in to
Okay.
examine the case. So ultimately, it
Mm.
is the doctor who has to do. Remember
The
that
calls.
exactly. Now remember that within this period of time, this is all these things are done in both the 3 minutes or 5 minutes we spoke about, and in the first 30 minutes, so that the faster the orthopedic surgeon comes, the faster the person
Right.
has to go into theater. Because if the fracture is fresh or whatever, it's
You should
easier.
be able to heal quickly and figure out
Exactly.
how to
So
heal
like
them.
I said, time is of the
Mm.
essence. So if you go to the ER and someone tells you to wait for 4 hours,
Okay.
that's not fair.
So that person literally wants you to
Yes.
give up in a sense. Now let's come to the uh, most recent situation that we found ourselves in and how it's brought our healthcare to the fore. And that had to do with the snake bite. I know that there are different snakes in the country. Some have less venom, some have more venom, but it's expected that certain hospitals should have antivenom. So in a situation like that, where you have either snake bite, you have someone who's breathing difficulty, what what are the steps to take and what basic drugs should or medication should a hospital already have on ground without having to tell the patient that we don't have this one to do. Let's do trial and error and see which one will work best for you.
Okay. So the first thing I would want us to understand is what the um what the snake venom does. All right. So you have to
Okay.
understand that.
Okay.
So once you understand what that happen does, then it
Mm-hmm.
will make you understand the kind of treatment it does and why it's important. Now, when people are bitten by snakes, depending on how venomous the snakes are,
Venomous.
sometimes you can get a minimal small reaction, while
Mm-hmm.
sometimes you can get a, a massive reaction. So what happens is this: the venom attacks different things. All right. One, it attacks the
Mm.
nervous system, shuts down
It
everything.
shuts
So
it
it's your
down.
nervous system that controls you. So the fact that so you have it's your nervous system that controls you. The fact that you're breathing is your nervous system that
Mm-hmm.
controls it. The fact that you can stand up is your brain that tells the nerves to stand up, move, exercise, do this, do that. All right. Two,
Mm.
it also affects the circulation. You have situations where venoms make blood clots. So ideally, as blood is yes, as blood
Ooh.
inside you, that's the problem. So
Okay.
as blood is flowing through you, it shouldn't
Mm-hmm.
clot. Because if it clots,
Mm-hmm.
it could block your heart or block your lungs or
Yeah.
block your liver.
Makes
That's
make
why
life worse.
that's why they always tell you to exercise and also we have that's it, that's that. Okay. So
Mm-hmm.
when it you get bitten, automatically. So I think we have to look at this from two angles. What
Okay.
we as bystanders should do, and then two,
Mm-hmm.
what the hospital does. All right. Now, one,
Mm-hmm.
like I said, let's say you get so most of the time there are focal areas where people get beaten. 85% of the time is always in the legs because maybe you stepped on it and it's
Okay.
you understand, or maybe beat in the hand, or you put your hand somewhere, whatever the case may be.
Oof.
So the
Yes.
first thing to do is to tie a tourniquet above the points of the bite.
Okay.
Now, what that does is it stops blood flow. It
Okay.
stops the venom from traveling to the rest of your body and causing problem. So let's say, for example,
Okay.
you get person gets bitten in the ankle, down. You can tie a
Mm.
tourniquet in the knee and prevent that buys
It
you
from
a couple of
traveling.
minutes, at least a
Right.
couple of minutes or 30 minutes before it goes round. All right. Now, because if you remember, they rushed her to several hospitals, they didn't have antivenom. If you remember, I think that's what they said. Those
Mm.
minutes would have been enhanced if there was evidence of a tourniquet tightly bound on her. That would have prevented that. So one, that's one. Two.
Hey.
Now, availability of antivenom. So we have different snakes, and each
Mm-hmm.
snake has its own venom, and
Mm-hmm.
each venom is treated as its own antivenom. But you see, that is the problem we have. Because most hospitals or most times the odds of having snake bites in there, so you know that there are certain snakes that are endemic to some certain areas.
Then areas.
Now, because here in Nigeria, most times we do not really understand the seriousness of these things. Snake venoms are expensive. I won't lie to you, but
Okay.
but ideally, and I think because they also expire, hospitals because most of the time they look at the economics of it. We stock up this snake venom that's expensive, and after some time it expires. What do we do? What
Expires.
happens to that money and
Mm.
all the rest of them? Now, if you go to the hospital, most hospital records, and they tell you how many people come in here with hypertension and diabetes, they'll tell you maybe 9 out of 10. But how many people
Right.
come in with snake bites? They'll tell you maybe 1 in 100 or one in this. You understand? More people come in with dog bites than snake bites, which is why I believe they were not prepared. But that's not an excuse. I'll have to say,
Okay.
ideally,
Okay.
every hospital should have some level of snake venoms, snake antivenoms. Now, in places like And the reason why we don't have this is because we don't produce them here, which is the
Right.
problem. Because they have to import them and bring them
Mm.
in, it
No,
becomes
that's a
expensive.
quagmire.
You understand? So in places like India, which is the hub of the snakes, you end up seeing
Oh, they
you,
have them in.
they
Oh,
have
yes.
loads of snakes, especially the king
Different
government and all.
ones. Oh, my
You
word.
have people locally helping the hospitals harvest because before you to create a venom, you must harvest. For you to create
The
an anti-venom, you must
mhm,
harvest the venom. So what they
right.
do is they meet all these people, these snake catchers and snake
Charmers.
whatever. Yes,
Mm-hmm.
they show the process. It's online. They will
Yes,
harvest the
in it.
venom from their teeth. They will use that, give it to the hospitals who will now
Hmm.
produce antivenoms. You understand? So what happens is you now have antivenoms in abundance everywhere.
Right.
America
Ah,
too also does that. So for the different snakes, you have antivenoms everywhere. Not only do you have them everywhere, you have
right.
them at strategic areas, and everybody knows. So you have more or less like I'll call it like an antivenom bank, like a particular hospital that has all the antivenoms. So you know that okay, oh, this
Once
person
it
just
hits
got
that
this.
thing.
You have it. You won't have it in totally in most of these like in Australia that
Hmm.
has
Oh,
a high
yes.
percentage of venomous
Oh, my
snakes. Yes,
word.
you have that.
It's one of the reasons why I've not still traveled to Australia because the creatures are out to get you.
No, Australia is a different thing altogether. Australia has you have animals that you have creatures there that are angry with you, even from the kangaroo. I think the only one is the only calm thing is the koala. Anyway, back to what we were saying. So that's where I'm saying. So we don't have that system. You
Hmm.
understand? I'm not saying saying telling everyone to get huge quantities of antivenom may not be economically sound because the truth of the matter is,
Fair
how are you
enough.
so sure that this
That you
antivenom will
have.
work for this particular snake? You have the
Ah,
cobra, you have the mamba, you have the black mamba, which is one of the most deadly. You have the sea snakes. You have you. They are different species
so
of
you need to
snake.
figure out what
Different,
snake
yes,
bit
exactly.
you in the first place. But here's something that also I think it was 2 years ago. So the young man had gone to use the restroom as well in his home, and unfortunately he got bit in the butt by a snake as well. So if you're talking about tiny tonic, now that even makes it worse. Um, I, I tried to think about that, but that
He
is
is
just
lucky. Someone had got bitten. A guy went to eat himself, and as he was doing it, he got bit where we do not need to mention. And then,
oh
but
my word.
no, he was lucky in the sense that um, it wasn't as venomous as that. Although the 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 organ in question grew very large because of the snake venom, but it still returned back to the size. I know, but that's one of the
Okay.
miracles. I, but I'm just saying. So the truth of the matter is that as a country, all right,
Mm,
we need to invest in our healthcare. There's certain things. See, most of this. Okay, let me give you. You see, what we don't understand is we necessarily do not have to outsource all these things. You have people who can manufacture this and we can test them. You have people. This is a country that is diverse.
now, since you're
Which,
talking about that, why
yeah,
is it? Well, I'm not saying why. Let me ask this professionally. Is there a way where they can get insight as well from the locals who get to treat this as well?
that
Because you hear in my
exactly,
village, it happens. You don't do like this, take this leaf, and you're good to go.
exactly. Which is what most people do. Because see, the truth of the matter is this: snakes have been biting people for
Since
generations.
right.
10 years ago, 30, 50, 60, 80, 100. What were they doing? How did they do it? Let's sit
Right.
down and combine that knowledge. Yes, we get from the foreign, we get from the local. Let's find a way to make it accessible. So the truth of the matter is this. Let's be realistic. Um,
Okay.
like I said, the reason why we're having the conversation, the reason why is because of what happened. And
Right.
she lost her
Right.
life. May her soul rest in peace. But
Mhm.
at the same time, when next are we going to talk about a snake venom? Next thing, when was the last time someone got bit by a scorpion? That was very something.
Oh,
That was the last
I,
time.
I, I had my experience whilst I was
Okay.
staying in Abuja and I was in school then. But yeah,
Okay.
here I am. Thankfully. Don't ask how I was
Was it a
able
big,
to figure.
was it a big or a small scorpion?
So it was a small scorpion.
That's why
So,
you're lucky.
but yes, I
Yes.
was I was lucky with the
Yeah.
fact that it was a small scorpion. I also caught it. Don't ask me how I was able to catch it. You are thinking of saving your life. You're not thinking of catching the thing that has gotten you. It was very scary, but we're strong like that. We're strong like that. But I'm not sure. I wonder ever experienced that of a snake. So
No, it's a very no.
let me let you go ahead, please.
Okay. So what we need to do as a nation is very simple. You see, we have different virology centers. So we have the National Institute of Virology Studies. You have
Okay.
different kinds of institutes that study things. I feel what we need to do is to say, okay, this is a problem we need to solve as a team. All right. Now,
Right.
for everybody to have antivenom at the same time, it's expensive and it's not economical. Nobody will
Mm-hmm.
want to spend, let's put it this way, nobody will want to spend 10 million naira on
Just to get.
antivenom when you will not end up using it. But
Okay.
let's say we have a center sponsored by the government or maybe
Mm.
whereby all venoms are available. And then you have a dispatch system, a
I can
timed
quickly.
dispatch system, whereby once
Right.
you're notified in 3 minutes, you tell because we practice, you keep pursuing. One thing about this is all these dispatch people that can fly. You have you have those guys. I said to God, those guys they give me joy. But sometimes when you pass their cars, it's problem. But you get where I'm coming from. You have a system, a dispatch system, whereby once there is a snake bite and
Mm.
it's a hospital, we identify
Mm-hmm.
the snake. We give you a call and say, oh, so and so place, it is a black mamba that bit her 30 minutes ago.
Mm-hmm.
We need the
Mm-hmm.
venom. Within 10 minutes, because all venoms are stored in that area,
You
they
know
bring
what?
out the one for black mamba, give it to the dispatch guy, he comes
Mm-hmm.
immediately,
Mm-hmm.
administers it, the
Mm.
person pays. I'm not saying it's going to be free of charge. We can make it
Oh
free of
no.
charge if we want, but we
Mm.
pay. That will save a lot.
Right.
Do you understand? So that because it's just like the same thing that happens with blood. We have a blood,
Mm.
so
Oh,
the
you have
government
blood
has what we
banks
call blood
everywhere.
banks. Exactly. Do you understand? So
So
even
it
if the
still
hospital
has
doesn't have blood,
something in that sense.
even if the hospital doesn't have blood, by the time they make a call, okay, we need O positive blood. Bam, 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 bam. They'll call this day. Before you know it, they give it to you. You pay after using whatever you guys decide on. That's what we need to have. Because honestly speaking, economically, if you tell the hospital to give
Store
you
all, it
how
wouldn't
many
make
will
any
they store?
sense.
How many snakes will they store? What's the
Mm.
what's the, what's the capacity that this one will work for all the ones that it could be, there's loads of varieties of snakes. So
Mm.
that's
Well,
my opinion.
we're almost out of time, but I have a question here from Ubina Gallagher. Good evening, as always. Glad to have you here. He says, well, despite all the points you've raised, it's a bit saddening that we do not have these venoms readily available in our hospitals. However, here is one thing he's asking, and that
Okay.
is, what are our pharmacists doing? Why aren't they developing vaccines that can not just neutralize snake venom, but also things that we need to keep surviving? So I think
Well,
our pharmacies need to, they're under the
okay, so
radar right now.
okay, okay. Okay, so it's a good question, but so it's not the pharmacist it's what you call pharmaceutical companies that develop
Right.
most of these things.
This.
Now, you see, these things are, I have to be honest with you, these things are driven by money. So you come out and say,
Mm,
what is the most common condition people have is hypertension. You can go to a pharmacy now and see 500 types of hypertension medications. Next is diabetes. What is the most common cause of that? Sorry, you have diabetes. You can see 500 types now of medications. Now, the question is this. Most pharmaceutical companies, I'm not talking about pharmacies, so we should understand. Pharmacies are dispensaries. They dispense the drugs. They don't manufacture the drugs.
They're not the manufacturers.
Yes, it's the pharmaceutical manufacturing companies that manufacture the drugs. All right? Now, once that is done, the question is, do they see the need for that? It requires, because they want to make money. How many people get, so that's where sometimes you have to go the extra mile. Those companies have to go the extra mile because they'll tell you how many people get beaten, how many antivirals will we make that will go round, that will make us the money, which is not good, I have to be honest, but that is where the government now has to compel them to say, this is your contribution to the country.
To life.
Sit down and manufacture this. We'll sponsor you. We'll give you money. We'll give you funds. We'll do this. We'll see. It is not something that one person does. So let me give you an example. Like the whole blood bank thing. There was a time when blood was not available. Everybody had to sit down. The hospitals, when people do blood drives, you see people, they want to do something charitable. They say, okay, everybody come, let's donate blood. The blood you donate goes to the blood bank and it's stored because for someone to use. Do you understand? That's why you see sometimes if the blood is not available, they'll do a blood drive. Everybody come and test yourself and come and donate to, all that and all that. So it's something we need to see that it's not just about blaming the pharmaceutical companies or pharmacies. No, we have to all sit down to see. Let's leave the economics behind
collectively,
and then go ahead and manufacture this. And by the time we do that, the same way we eradicated what do you call it now? Regards to blood not being available, even though we still have shortages, it's the same way we focus on this.
Well, one thing I'm hoping that we get right is our medical situation sorted. It's not just emergent. It's not just in situations like this. I know the last time we talked about this as well, there was a high-profile situation that brought that to the fore. We need to stop waiting for high-profile situations. So if someone is not high and mighty, that means the person's life doesn't, you know what, there's someone that's always asking. And I think that is what we need to start, asking ourselves equally. What is the value of a Nigerian life? Maybe once we know what the value of a Nigerian life is, our perspective will change. Until then, one thing I would like to ask from your standpoint, because we're out of time, and I really need to, I need to also let you go in a few, is what do we need to look out from? What do we need to look out for that could serve as a red flag where hospitals are concerned? They may have fancy building, they may have all the glitz and glam, but once it comes to tendering to patients and all that, what are the things we want to look out for so we are we're ready and we know how to put ourselves in the best protection, because we have to protect ourselves even if litigations can happen later.
Yeah, so what I did was I actually wrote a book on this for people to understand, because the truth of the matter is this: it starts from the moment you walk in. So, for example, the moment you come in and someone tells you to stay, they'll 30 minutes. You stay 3 hours before they treat you as an ER case and all. That's rubbish. All right. So what I did was I wrote a book for everyone to observe, to see what you need to do, what you need to get in the hospital, the questions you need to ask, your rights, how they need to attend to you, how fast it needs to be. Because at the end of the day, the truth is this: nobody wants to go to the hospital. For example, instead of you to go and hang out with your friends, you're only going to the hospital because you want to be taken care of, or you have a pressing need, and that need needs to be taken care of. So what I try to tell people is, certain things you have the right to ask. The certain thing, example, you're coming into the ER now, or coming to be taken care of. You'll have to ask, please, how many minutes will it take for them to get to see me? What is your turnaround time? Once you ask that question, they know you know your rights. They know you know your rights. So that's why I wrote that book, which I want everybody to have a look. It's your guide.
Talking about that, so I'm out of time completely. How can they reach out to you to get the book, get access to it, your social media handle, so
Yes,
Lagos
so they
can
can.
reach out
Yes,
to you and get all that
and
insight?
so they can get to me at Toby Ozuzu on Instagram, TOBYOZUZU on Instagram, or my name, or Tobechi Ozuzu on LinkedIn. Those are my two social media handles. Toby Ozuzu on Instagram, TOBYOZUZU, and then Tobechi Ozuzu, TOBECHIOZUZU on LinkedIn. The books are there. It is for everyone. You will know your rights, because it's so painful that you don't know your rights. Like, you don't know what you should
You don't.
expect. The questions
Exactly.
you should ask the doctor. Once you do, trust me,
Everybody will
everybody's
sit up.
sitting up. Everybody's sitting. Nobody wants to be sued. Nobody wants. You don't have to be a celebrity or highbrow to demand the best. You as your own, because everybody has now realized that, we need to be better for things to work
Well,
out.
Lagos, it's important to take care of yourself. It's not just Lagos, the world entirely. Everyone needs to take care of themselves. You need to be on top of your health. And that's why we have Smooth Health here every Thursday at 5:15. But I need to go. I want to say a very big thank you to Dr. Tobechi Ozuzu for
You're
his
welcome.
time and
Anytime.
all that
Anytime.
insight. There's still much more ahead. For you, I want to move a muscle.
Thank you. I
Oh my word.
hope I was able to answer. People will be interested in this. Like,
Oh my, trust me. If I could, I'd keep you and continue the conversation.
no,
But
but
it was
it's a painful thing that girl had to die. You see, and I
and
think
it's sad.
it's
It's
sad. And
sad.
I tell people, you see, the problem is this: we do not maximize our level of knowledge most of the time, and it's an advocacy I would want people to do. So let me give you an example. Let's say someone gets bitten by a snake. Nobody knows what to do. People do not know what to do. I don't see why we cannot, as a nation, utilize, even if it's social media, even if it's NYSC, go